Dr. Christina Conolly, and welcome again to our MCPS video series, Waymaking. Our goal is to help families make their way through many of the emotional challenges we are faced with today. During this time of filming, I wanted to share with our audience, and I am recording from my home office. This is why I do not have a mask on today. I have with me today Ms. Heather Dublinske, who is the COVID-19 coordinator, and Doug Hollis, who is the Executive Director of Operations. Thank you for joining us today.
Thank you, Dr. Conley.
All right. So today we are discussing the impact of the COVID-19 Delta variant in schools. My first question is, what are the schools doing to keep students and staff members safe during this time?
I think one of the main things that we're doing is just really having a multi-layered approach towards COVID-19 and our response to it, and particularly now with the Delta variant, as we've gone back to school 100% in person. And so I think some of those approaches are things that we commonly know of already in our schools and other settings, such as wearing our masks, as I'm doing because I'm in my office now, but also things such as when there is an opportunity to keep some distance, we try to do that. We try to be aware of our surroundings, washing our hands constantly. But I think the other thing that we're doing is really introducing opportunities to have more education around vaccination, as well as more opportunities for testing. And so we've implemented random testing and started to do that in some of our schools, and hope to get to all of our schools very soon around that for asymptomatic testing to get an idea of what we look like as a larger school system. And then we also have introduced rapid testing, which Heather has been really instrumental in working with our Department of Health and Human Services with.
As Doug said, we have a number of mitigation strategies that are happening in our schools every day. Wearing masks is required for anybody on site at an MCPS school or office. I am today filming from home, which is why I'm not wearing a mask, but all staff and students are required to wearing masks while on site. Many schools have created outdoor spaces for students to have additional space to spread out during lunch and other unmasked times. We're also doing on-site individual testing for students, as well as symptomatic rapid testing for students, so we can quickly determine if a student has COVID and initiate contact tracing to have any close contacts quarantine.
Oh, thank you both for that information. And so then my next question is that we are hearing from a subset of staff and families that they are fearful of returning to the school building. What advice would you give to help them feel comfortable returning to school?
Definitely empathize and understand that this is a very stressful and anxious time. We have been home for the past 18 months. It's been 18 months since we have had schools at full capacity. And while we were so excited to bring all staff and students back, there is some concern and hesitation about being around that many people at one time. So again, we're putting those mitigation strategies in place. We're following CDC recommendations and guidelines. And one of the things that really helps me keep in focus is looking at the data. Montgomery County is one of the highest vaccinated counties in the entire country. And we are very fortunate that while there has been a slight increase in the Delta variant and cases among children, that there have been no serious illness or deaths in children under 12 in Montgomery County. And so the practices that we have in place are really keeping our students safe in schools and in the community.
Yeah, I think Heather's points are exactly right. I think the data is a great place to start. I think additionally for me, I just think about myself and just being in tune. And one of the things I would encourage everyone to do is to make the first step. I think there's been a lot of times where we first experienced COVID and we were kind of in our homes and stayed there all the time. And then we said, oh, I need to go to the grocery store. Once you make that first step, you'll realize that it feels a little familiar. And then that helps you along the way. I think school has been the same for those who came back in the spring and now those who are experiencing school now. Yes, it's more people, but with that multi-layered mitigation strategy, pushing yourself to make that first step is just critically important for you to just be able to feel better about it. And then I say lean into the things that we're doing. Everyone has a mask. You wear your mask, other people wear their mask. Feel confident in the mask. People are going outside and taking breaks. As Heather mentioned earlier, lean into that space and being outside and reflecting on other things in life during that time, as well as just using that as a mitigation strategy. So I think all those things really help. They help me at least during the day. I've taken more walks since being back at work than I have in the past. And it's been good for me and my own mental health. And it's just good strategy for all of us to really lean into.
No, thank you all for that, and thinking about what the both of you said in terms of looking at the data, as a psychologist, that always, we're always looking at data as school psychologists in our schools. And, but then also, you talked about taking that first step. And I know for many of our audience members who may be watching this and feeling anxious, about this or fearful of going back to work, going back to school, taking those first steps really do help, and I think about it in terms of, providing like certain types of therapy. Part of it is, taking those small steps forward to get you out of the house. Maybe it's instead of ordering Instacart, you go to the grocery store and you get the groceries, or you take the step and you go to the CVS, whatever it may be, the small steps to move forward so that you can make the big leap, eventually into returning back to the building. All right. So then my next question is how is the support that you are providing to schools now different than in prior school years?
My role has completely changed, as I used to provide different support to staff members in schools. I am now completely focused on COVID-19 support to our principals, our schools, and even families when they have questions about our policies and practices that we have in place. I dedicate my day completely to supporting this because it's so important. It's something that, even though we have been dealing with it for the past 18 months, it's ever changing. So the rules change, the guidelines change, how we're reacting changes. It's a lot of information for people to take in. And I always want to ensure that everybody has the most updated information, and also so they can focus on in-school activities. Students can focus on their learning, administrators and teachers can focus on supporting students, and I can take that other added work off of them by supporting this COVID work.
Yeah, I would agree with Heather. It's been different and it's been good. I think, as Heather mentioned earlier, kind of the pandemic and working from home for 18 months has caused me to slow down. It's caused me to be in touch with my own kind of thoughts and feelings about things versus being fairly robotic or regimented about everything I did. And so that also then allows me to provide better service, I think, as an educator and a practitioner to our schools. What used to be done all the time by an email is now making me think about it a little bit differently. I make a phone call. There are schools that I need to visit. I need to see what it looks like, what it feels like, to really be able to connect with those practitioners, our educators, our administrators, even our students who have an experience that feels different to them. And sometimes you just have to just take a moment to live in it, just a moment, for you to be able to advise and provide greater service to them. And I think that's led to us being more thoughtful and patient with each other, but also just really looking at a system approach, but also the individuals in the system. It's easy to get lost in MCPS with as many students as we serve, as many staff and families and communities that we serve. But this has caused us to slow down a little bit and really think about what is the individual impact and how can I do that best, even in the midst of COVID. And I think COVID has actually made us in some ways better in that way.
The relationships that have been renewed and strengthened during this, you often see in times of difficulty and stressful situations, people come together, and that is completely true for the staff of MCPS. We are gracious and understanding towards each other. We're patient, we're supportive, we're helpful. It has really become a community of work to see this through COVID.
And thank you both for that. I appreciate your statements around that, and the collaborative nature of your work. It really has caused us to come together, in order to address, the crisis at hand. So thank you both. Now, my last question is, so do either of you have suggestions or feedback for families and students to help them to stay resilient during this time?
Resilience is such an important thing to keep moving through difficult situations. I encourage families to, again, do the things that are going to protect yourself and your children, and encouraging them to wear masks even when they're not in school. If they're in indoor spaces, at birthday parties, at other events, to wear a mask. Sign up for the in-school testing that we're offering. The more families and students that sign up to participate, the quicker we're able to identify any positive cases and slow the spread of COVID within our schools. Also, just being mindful of the things and, not always focusing on COVID. It's easy to get kind of sucked into the constant news cycle and the information and the social media that seems all about COVID. It's really important to take a break from that and focus on the things that are going to recharge you, that, can bring your family closer together, and kind of focusing in other things besides what can oftentimes feel overwhelming and scary.
Yeah, I would echo everything that Heather has shared. I think my big statement would probably be lean into the shared experience. You're not doing this alone. And so I would just say, if that is the experiences that you have with your family, or if it's experiences you have with your friends, or your favorite teacher, or your favorite neighbor, whatever the case may be, lean into that. I think that is what has made us better as a school system. The idea of, we bring so many different things to the table, but this opportunity to actually have a shared experience, and then to see that, hey, we made it through this 18 months of virtual school. And if someone had told us before then that's what we would have been doing, we probably would not have believed them, right? And so now someone's telling you you're going to be back in school, you're going to wear a mask, you may eat your lunch outside some days, you may eat your lunch spread out in the cafeteria other days, but you can still go to school and experience it in other ways that you haven't experienced before. And so I would just say really, really embrace that. And then whatever it is that you have personally in your life, be it a friendship, be it counseling, be it a religious community, whatever it may be for you that helps you ground yourself and get centered again and re-energize, as Heather said, please lean into that as well and bring that to the collective.
I want to thank you both, Heather and Doug, for your time to be with us today. And we want to thank our viewers for joining us for Waymaking. To send us additional questions and topics to discuss on the show, please visit the link on your screen. Also, please go to our YouTube playlist to find additional shows in our series. And please join us next time on MCPS Waymaking.